All right, hello everybody. My name is Michael Keene, Doctor of Acupuncture. I'm here to give a presentation on the topic of De Qi, which is it translates as obtaining the Qi or the arrival of the Qi. This is a very important concept and topic pertaining to acupuncture practice, to the theory and the practice of acupuncture, and it goes back to the very beginnings of acupuncture theory from the original classics of Chinese medicine, such as the Neijing and Lingshu. And it has an important place in Chinese medicine and acupuncture theory all the way up to the present, where De Qi has become somewhat of a foundational concept in relation to modern scientific research of acupuncture. So, as an acupuncturist, as a clinical practicing acupuncturist, De Qi is actually one of the most important topics, in my opinion. And unfortunately, it's one which is often overlooked or not really given much more than a cursory kind of um, explanation, or, you know, it's not really something which is really explored in depth in normal acupuncture training. So I wanted to make a continuing education course which really delves into the whole aspect of De Qi, what it is, where it comes from, and its history from the past all the way through to the present, giving a broad overview. So that's what we're doing here today. So welcome to this course, and we're probably going to be breaking it up into a few different parts because I have brought together quite a bit of information into this presentation. So we're going to maybe break it into three different parts. The first part here, we're going to be giving an introduction over De Qi, and let's look at the whole overview here. This is the whole presentation, but the beginning we'll be introducing De Qi. We're going to look at a lot of excerpts from the classics about what they say about De Qi and how they talk about it. Later in the presentation, we'll be talking about De Qi as for how it pertains to the acupuncturist and also for the patient, because De Qi is a phenomenon which is experienced differently by the patient and the acupuncturist, but both of them simultaneously. So we'll take a nice look at that and see how that figures into the concept of De Qi. We're going to look at the qualities and characteristics of the sensations that are felt by the patient with De Qi, but also the qualities that are observed by the acupuncturist. We're going to look at the concept of needle grasp, which is a kind of related topic to De Qi that comes about more in modern science research about De Qi, but we're going to be looking at how that relates to the fascia and to how that can conduct mechanotransduction signals throughout the body. And this is an important topic to understand, to realize how acupuncture is able to actually send signals throughout your whole system, and De Qi is a key part of that. Then we're going to look further into De Qi at how it is implicated in the neuromatrices of the body, and how when De Qi is attained, it is able to modulate various neuromatrices. And this is confirmed through fMRI research, and we'll be able to look at a bunch of different interesting pictures and slides and research studies briefly to just see how the fMRI studies confirm the different reactions to De Qi sensation as opposed to maybe other sensations like pain. And we're also going to look at some of the theories for how acupuncture, and in particular De Qi, is able to modulate the psycho, neuro, endo, immune, and inflammatory systems of the body, which are all interrelated, holistic systems of the body. And acupuncture is basically, through these means, able to have a whole systemic modulatory effect. And we're going to try to wrap it up by looking more directly and specifically at how De Qi is an important concept when it comes to our clinical practice as acupuncturists. So it's not only just a theoretical thing or an abstract research scientific concept, but, and I think this is the most important thing about it, because my main focus, even though I'm very interested in the research and the science of acupuncture and the classics, is how is this relevant today to your everyday clinical practice. And I would say that De Qi is maybe one of the most relevant things that have to do with the everyday clinical practice of acupuncture. And building a mastery over this topic and this concept will, I think, make you a better acupuncturist, because it's something that is relevant to every single acupuncture treatment that we do. So what is De Qi? De Qi is commonly translated as obtaining the Qi, and it refers to the essential physiological reaction to an acupuncture treatment, which signals a positive treatment effect or a reaction. To quote, De Qi is an important traditional acupuncture term used to describe the connection between acupuncture needles and the energy pathways of the body. It is what happens. It is at the very focal point of when acupuncture has its effects, and those effects manifest physiologically. So it is right at that pivotal moment of acupuncture's effect. The meaning of De, specifically the character De in De Qi. We all know Qi. Qi is a very complex term, and we're not going to go into that too in-depthly. That's a whole other topic for another presentation. You know, we often leave Qi untranslated because it doesn't have a direct correlation in English, but De of the De Qi concept often gets translated as to get, to obtain, to acquire, or to gain. So essentially, the definition is causing the acupuncture needle to elicit the sensations associated with the presence of qi at or near the insertion site. These sensations include subjective sensations in the patient and an objective sensation felt by the practitioner's fingers. So, De Qi is the physiological sign of acupuncture's effect. It's perhaps an essential component of acupuncture. It cannot be overlooked. It's absolutely essential. And furthermore, it can provide clinically valuable diagnostic or prognostic information. So, you know, if what I mean by that is when you're trying to get the acupuncture qi sensation, the De Qi, to arrive, when you want the qi to arrive at the acupuncture point that you're needling, for instance, it may not arrive. That could tell you that this person has a qi dysfunction of some kind. If you cannot achieve the qi, and the qi does not arrive, it may be telling you that the qi is very weakened in this function or in this system of the body. If it arrives quickly, that's a very positive sign. It also gives you prognostic information. So, you know, if you're doing acupuncture on someone and you are unable to attain the qi, if the De Qi does not arrive, if the qi is not obtainable, that's going to say that the acupuncture may have not a very good effect. If the qi does arrive, that is to say that the acupuncture may have a very beneficial effect, and the patient is going to see results from the acupuncture treatment. So as the acupuncturist, this is very important prognostic information, because when you are able to attain the qi, you can be confident that your acupuncture treatment is going to have a positive effect. In the classics, they often have various different terms for this concept that they use interchangeably at different times. For instance, one of them is qi zhi. This is traditionally other terms have been used for the same phenomenon, but basically they all kind of mean the same similar thing, which is that the qi arrives at the point. The qi arrives at the place of acupuncture. These concepts all go back to the original texts of acupuncture, such as the Neijing Suwen and the Lingshu. But to be clear, De Qi is regarded as one of the most important principles of a successful acupuncture treatment due to its relationship to clinical efficacy. So let's take our first excerpt from classic texts here. This is from the first chapter of the Lingshu. And I'm getting this translation from the Jingyuan translation of the Lingshu. They say, only when the qi is reached will the acupuncture be effective. This effect, it is said, is as if the wind blows away the clouds and clears the azure sky. Which paints a very beautiful picture, but it's like this spontaneous effect. It's like we don't have control over the wind. We don't have control over the movement of the clouds, but when the qi arrives, when it attains, it's almost as if the spontaneous reaction suddenly blows the clouds. The wind comes and sweeps away the clouds, and the condition of the sky is changed. So they're painting this picture of De Qi, of its spontaneity, of its arrival, of its effects in changing the environment. And here's an alternate translation of the same passage, which the reason I'm sometimes giving alternate translations is just to impress upon you that, for those of us who have maybe not read much of the classic text, this is in the classical Chinese language, translations are often uh, they often vary greatly, and different translations depending on who's translating it and their ideological background and their goals and their inner concepts in relationship to acupuncture, maybe they have different translations. So let's compare that, what we just said, to this Unshuld translation. And he says, when the chi arrives, then this shows the effect. The effects, they are as reliable as the wind that blows away the clouds. They are as clear as the appearance of a blue sky. This is all there is to the way of piercing. So I find it useful to compare different translations. And at times, even this has pushed me to try to make my own translations. So to continue, Lingshu, chapter 1, further says, and this is 3 different translations of the same passage, in acupuncture, when the chi is reached, do not ask the measure, but needle until the chi is reached. And that's De Qi, until the chi is reached. Once reached, do not repeat. Now for the Unshuld translation, he says, if when piercing the vessels the chi fails to arrive, one must continue regardless of how often one has pierced. If when piercing the vessels the chi arrives, the needle is to be removed immediately. One must not needle again. And I decided to make my own translation of this same text for whatever it's worth. And what I wrote is, if one pierces and the chi does not arrive, continue however many times. If one pierces and the chi does arrive, thereupon depart from there and cease the acupuncture. So you can see how there's variations to each person's translation of this just short 1-sentence text. And I find that it's useful to compare the different translations because they all give you a different idea of what this person might have been meaning when they wrote this originally all those years ago. Continuing onwards, in Lingshu chapter 3, they say, the needling is effective when it obtains the qi. The acupuncturist must obtain the qi. If the qi has arrived, fastidiously hold it and do not lose it. Once the needle has come into contact with the qi, it is essential to aim at guarding the qi lest they get lost. So these passages all place a very strong emphasis on the attainment of the qi. It is an important moment during the acupuncture treatment, during the acupuncture process. It's really trying to place an emphasis for the acupuncturist to be aware of when the qi arrives. And when that happens, that is an important moment. We must hold it fastidiously. We must not lose it. And also, it's important for the purpose of the acupuncture treatment. They're saying, like, this is basically the purpose of the treatment itself, the attainment of the qi. So Lingshu chapter 9 says, the acupuncturist should devote all of his or her concentration to the needle. Keep the needle on the surface and move it gently until the qi has arrived. When the qi is reached, there will be an effect. Now moving on to the Suwen, here's a much longer but very evocative passage. When the moment has come to deploy the needle, the interval between decision and action must not even be as long as the blinking of an eye. The hand is moved with full concentration. The needle shines and its shape is even. The sentiments are calm and one concentrates on what is right to do here. This way one observes the changes as they happen. This is what is called obscure. No one knows its physical appearance. One sees its woo-woo. One sees its ji-ji, which is kind of an onomatopoeia that they're using, the sounds. From seeing it flying, one does not know who it is. The needle lies down like a crossbow, and it rises as if a trigger has been released. So I find that last part especially to be interesting, to rise as if a trigger has been released. And I believe that De Qi is sort of like that trigger. The needle being the crossbow, but its purpose is to activate the trigger. During acupuncture, the acupuncturist should concentrate on the changes of qi in blood after the needle is inserted. Usually, the changes are too subtle to be felt, and sometimes for the acupuncturist, arrival of qi may feel like a bird flying. He or she may not understand why this happens. So what I take from this is we need to, as the acupuncturist, learn to pick up the subtleties that are involved in the arrival of qi, in the de qi sensation. We need to be very conscious of when the qi arrives at the point, because it's very subtle. People who have not done enough acupuncture may not have become attuned to it. They may not notice when the qi arrives. When I first started doing acupuncture, I was so focused on so many things, just insertion of the needle and being aware of not hurting the person, and there's so many minutia of things that we're focused on. But as we get better and better and we gain experience and we learn what happens with the acupuncture and we become familiar with when the qi arrives at the point, we become very sensitive to that sensation. We notice when there's a reaction. We know what the different sensations might feel like and what they might feel like to the patient as well. We need to cultivate that. I also find the idea of it, the chi may feel like a bird flying. It's like if you've ever seen a bird just take off, it's so spontaneous, or like, it's like the bird is doing its thing and then all of a sudden whoosh, it just takes off, right? He or she may not understand why this happens. It's like, for me, the practice of acupuncture is, over time, gaining experience and practice and learning, we're trying to understand why this happens. We're trying to understand the significance of when this happens, and it's a big part of acupuncture. This is the point of why De Qi is important. So in the commentary, this is the Unschuld commentary, there's a couple comments about this passage, which I feel like impress upon this point even further. Zhang Jiebin says, the arrival of the qi resembles the flocking together of crows. Now, all this has no center, and it is impossible to find out who is in control of these movements. Wang Bing says, that is to say, success and failure in piercing appears to come out of the void. As if one observed the coming and going of birds, how could anyone know who is responsible for their moves? All one sees is whether the conduit vessels have signs of abundance or depletion, and one trusts them. One does not know who has called them or sends them away. I find this very fascinating because this is a furtherance of the bird metaphor. Not just one bird, but the spontaneous movements of a flock of birds, how they move together spontaneously. It's almost of an intelligent design. And that is relevant to how things happen in the body with acupuncture. It happens spontaneously. We don't, the inner workings of the body and the chi are so complex. We don't necessarily understand every minute detail of it. We, as human beings, it's not like we are this all-knowing, omniscient, omnipresent entity. We don't know every single position and trajectory and velocity of every molecule of the body. And it's almost like these commentators, they're saying, they're being humble about it, and they're saying, we understand that there's greater mechanisms at work that are beyond our understanding. The chi moves spontaneously. Who is responsible for it? To me, these passages, they're really kind of giving homage to the mystery, to the grandness, and the intelligent design of the human body, and how it seems to respond so spontaneously and in an all-encompassing fashion to the arrival of the chi with the acupuncture. And this all happens, and what we do is we just see the signs. We just see the spontaneous movement and the flocking of the birds, so to speak. And we can understand, okay, this is a sign perhaps of depletion. Maybe the chi does not arrive. Maybe it's very slow to arrive. Maybe the reactions are very weak. Or maybe it arrives strongly. Maybe it arrives all at once without barely any actions. Sometimes when I'm inserting the needle, I have to really try to get the chi to arrive. I have to spend a lot of energy and use needle manipulation to really try to attain the chi. So that patient may be very depleted or very deficient, or perhaps just that meridian is there's a disorder, a depletion disorder. Or sometimes I insert an acupuncture needle and it's like I don't even barely insert it. I barely even touch them. Immediately the chi arrives at the point. I have not even barely inserted it. It's so superficial, but the reaction was so strong. I find there to be a lot of difference in these two kinds of reactions, and so perhaps that's what Wang Bing is referring to. We see the signs of abundance or depletion, and we have to trust them. We don't know all of the inner workings of the entire system of this person, but we understand the signs that they exhibit, and De Qi is the way that those signs are presented to us. So let's look at another classic text. This is the Zhenju Jiayi Jing by Huang Fumi. This is another classic text, a little bit later than the Neijing, but still very classic text. And in it, they say, the yin and yang channels of the hands have ready access to the qi. Thus, the qi arrives quickly when needled, and the needle should be inserted to a depth not exceeding 2 fun, and it should be retained for a duration not exceeding 1 exhalation. So this is an interesting passage, and it's commenting on the qualities of the De Qi specific to, maybe like the shoe points of the extremities of the hands, and they're maybe highly potent acupuncture points. It's kind of giving the idea that maybe different points on the body will have different De Qi reactions. That's how I interpret it. Maybe certain points, for certain reasons, we may experience a different strength of the De Qi reaction, or maybe we want to keep the needle inserted for different durations of time. These are all things which I don't necessarily think that this passage explains in enough detail, but it's interesting in that it's bringing these ideas to our consciousness, because he's talking about maybe different needling techniques for different purposes. Further, he states we need to remain calm and intent at all times, observing the response to the needle and awaiting the arrival of qi. The response of qi is said to be mysterious, subtle, and without form. The appearance of qi is like the soaring of flocks of birds or the swaying of millet in the fields, which, though perceptible, cannot be discerned. Retaining the needle is like lying with a bow fully drawn, ready to shoot, and extracting it is like letting the arrow fly. In needling vacuity, there must be replenishment, and in needling repletion, the evil must be evacuated. Once the channel qi has arrived, the opportunity should by no means be missed. The depth of insertion requires careful calculation, and regardless of whether the condition is old or new, single-mindedness is required. As if perched above a fathomless abyss, with one's hand grasping a tiger. When holding a needle, the spirit must not be distracted by anything. So that's a pretty heavy that's a pretty heavy passage right there. A lot of different metaphors. He's bringing all of the metaphors of the past passages that we just looked at together, and even adding some of his own. But I love how he says retaining the needle is like lying with a bow fully drawn, ready to shoot, and extracting it is like letting the arrow fly. Very interesting. We have to, with passages like these, we have to read them and really consider what they're saying, I think. But my job is to bring them all together for you in this presentation so that we can stew on them and we can consider their meaning in a deeper way. But we've got a lot to go, so let's keep going here. In the same book, Huang Fu Mi says the key issue in needling is to ensure that the qi arrives and has an effect. This effect is said to be like wind scattering the clouds to reveal the clear sky. So just as before, same kind of deal here. This concludes the principles of needling. In the Nanjing, chapter 27, it says, insert a needle along the route of the channel to induce de qi firstly. Then, once you have that, thrusting the needle inward is a supplementary method, while lifting the needle outward is a draining method. So now we introduce new concepts. This is starting to give an understanding of what Huang Fu Mi may have been talking about, where the moment of De Qi is an important moment. It has great bearing on what is called supplementation or the draining methods. We get taught these in school, but maybe we aren't fully given the concepts about what exactly does that mean. We talk about all sorts of different needle manipulation techniques, but in the Nanjing they're very explicit that when there is a supplementary technique that you want to apply, you want to slowly insert the needle after the De Qi has arrived. When there is a reduction technique that you want to apply, you remove the needle. They also, this isn't mentioned here, but with supplementation, you want to close the hole after you remove the needle. In the Nanjing, that's an important thing because you don't want the qi to come out, they say. So you take a cotton ball and you close the hole of the needle, you press upon it with your finger. But when you want to drain something, when there's an excess, when you remove the needle, you don't close the hole. It's okay if the qi in the blood comes out a little bit because you want to drain the pathology. There's an excess, there's pathological qi in the channel. If you let it come out, that's a draining method. So those are the kinds of things that you want to keep in mind when we're talking about De Qi, because that is the moment where we can apply various methods like that, if we so choose. Sometimes it might not even be necessary. Sometimes just attaining the qi is all that is needed. Different schools of thought put different weight on various needle manipulation techniques. Some schools of thought, like if you're really trained in the Nanjing, that might be the way that you do things. Other schools of thought, like Master Dung, he places a much more of a premium on simply just attaining the qi and less so on needle manipulation once the qi has been attained. So some people think just attaining the qi is what's important. The Nanjing shows that certain needling techniques for supplementation or draining are applied after De Qi. The Nanjing describes De Qi as the basis and premise of acupuncture manipulation. It may indicate that De Qi and Qi Zhi are not exactly the same, and that De Qi refers to the first period of Qi Zhi, which is the sign of ideal efficacy. So basically, now it's bringing in even more subtleties to the De Qi phenomenon. De Qi is the Qi arrives at the point, but maybe Qi Zhi is, what you do with it, how you do something with it. It is maybe has to do with the manipulation, the acupuncture technique that is performed upon the arrival of the qi. So just food for thought there. It's kind of opening up the concept and broadening it somewhat in the ideas of the Nanjing. Then you have another text called the Zhenju Dacheng, the Great Compendium of Acupuncture and Moxibustion, which is something that I'm kind of currently translating because I got so obsessed with De Qi. So we got to find out what things say. Not all of these passages have been translated, which is kind of crazy to me. So if the qi comes quickly, the effect will be quick. If the qi comes slowly, the effect will be slow. If it does not arrive at all, it is a fatal sign for sure. So once again, prognostic value is being attached to De Qi. Here, De Qi is signified not only as an effective treatment, but it's also indicating the speed of and the potential for recovery. Most contemporary TCM doctors still seek De Qi and regard it as a sign of efficacy. So the speed with which the qi arrives with De Qi can be interpreted as a prognostic sign of value. In the ode called "The Song to Elucidate Mysteries," which is the Biao Yo Fu, the more quickly qi arrives, the easier the disease is to cure. Supposing the qi does not arrive, the patient may be hard to cure. This is a reiteration of that prognostic value and the diagnostic value of De Qi. Here, once again, we get a powerful metaphor from the Zhenju Dacheng. The acupuncturist may feel as though the needle is being firmly grabbed and moving roughly when qi arrives, but only loosely grasped and moving smoothly if qi does not arrive. Qi arrival feels like a fish biting a hook and bobbing in the water. If qi does not arrive, the acupuncturist feels as though the needle is in a quiet, empty house. Powerful visual there. In the song To Elucidate Mysteries, it says, then the acupuncturist should perceive the qi carefully. The sensation of loose and empty beneath the needle means qi does not arrive, while heaviness, tightness, and fullness sensation suggest that qi has arrived. When qi arrives, manipulate the needle properly according to cold or heat symptoms. When qi does not arrive, wait for qi according to deficiency or excess conditions. These passages begin to describe the concept, in my opinion, of what is now known as needle grasp. It is a De Qi phenomenon experienced from the practitioner's perspective. Now, the purpose of De Qi is essentially what it says in the Lingshu chapter 9 here. The total way of acupuncture is to harmonize the qi and then stop. To tonify yin and to dispel yang will make the tones of qi full of excellence. The ears will hear, the eyes will see brightly. The opposite of this is when the blood and qi do not move. Therefore it is said, when the qi is reached, there will be an effect. The way of all piercings aims at regulating the qi, and then the treatment is to end. To supplement the yin qi and to drain the yang qi will make the voice qi clear and pronounced. Ears and eyes hear well and see clearly. If one acts contrary to this, blood and qi will be unable to move. Thus, it says, when the qi arrives, it will show an effect. That's two translations of the same Lingshu passage. So, we're going to take a break here. Those are the slides on the classic texts of acupuncture regarding De Qi. We're going to continue in our second part where we overview a lot of the De Qi sensations from both a patient perspective and also from a practitioner perspective, and kind of gain a much deeper understanding of what does De Qi feel like. What does it feel like for the patient, the different sensations of De Qi that they are going to experience, as well as the sensations that they can experience which are not De Qi. We're going to juxtapose De Qi against negative sensations which are actually a hindrance to acupuncture, which is important because we as the acupuncturists need to develop powerful needle technique of even just needle insertion to make sure that we attain the qi, but we don't want to get these negative qi sensations which run counter to the purposes of acupuncture. And then we're going to look at the patient experience of De Qi, which is essentially what does the acupuncturist feel when the qi arrives, when the qi is attained. And that is just as important, potentially, depending on who you ask, as what the patient is feeling. Because we as the acupuncturists need to also cultivate our ability to sense the arrival of qi, to know when the positive acupuncture effect has taken place. Because as we just saw, acupuncture De Qi is the most important sign maybe of acupuncture's efficacy. It's going to be a hugely important sign to tell you as the acupuncturist, this treatment is going to be effective. It's also going to tell you this is when I want to do a specific needle manipulation technique, whether it's a supplementation or a drainage technique. So the ability to have the sensitivity and the clarity of perception to know when the qi arrives as the acupuncturist is important. And to do that, we have to know, what are we supposed to feel? What are we supposed to sense? So these are some of the things we're going to look at in our second part. And then in our third part, we're going to go further and look at more modern research about De Qi. We're going to look at needle grasp phenomenon. We're going to look at some fMRI research and see how acupuncture and the De Qi response affects the inner systems of the body, like the nervous system and the endocrine system, how it affects brain function. We're going to look at a lot of different research studies and look at a lot of really cool scientific research to see how this has been observed so far in the research literature. So this has been part one. Make sure you tune in for our next two parts, and we're going to delve into all of that stuff. And I think it's going to be great. Thank you so much.